so much for joining book club today. Don't forget to like and subscribe and get ready to hear from some doulas who knows why.
Do you have any, like, because it starts talking about galactagogues, and that's like such a happy topic in some circles, because people just love galactagogues and suggesting them every chance that they get. How do you talk to families about galactagogues, or do you?
I don't. No, I stay away from these conversations almost entirely, except to let my clients know that the conversation exists and to send them information on it. If they want me to walk through the sources with them, I absolutely will. But there is so much that is in my scope to do that I don't even really have time to get outside of my scope and start doing this kind of stuff. And it's something I'm really careful with, because you can mess somebody's journey up by giving them the wrong information. And I never want to be the reason that a client has a harder time, you know?
Mm-hmm.
So I'll be like, oh yeah, like I've heard about those. Those are great. Here's some information on them. But because there's a lot of medical stuff in there that I don't know, and I don't have medical training, I'm not the person to talk to about it. Kind of in the same way that I do for like labor medications, where I'm like, yep, this is, some very basic information on it. These are all your options that are available. Here's some like potential side effects. Please read these infos. And then I would love to be around when you have that conversation with your medical provider. But I'm not going to say and tell you, you should or should not take this medication or this herb. And a lot of people don't consider herbs to be medications, but they are. They're great medications, but they are medications. And so I should not be telling you what herbal supplements you should be taking, for example.
Yes. Herbs can have just as many side effects as pharmaceuticals have.
Which is why they can be as effective as pharmaceuticals. There's the positive of it where you say, this can work. But obviously, if it's working, it's making changes. It's doing something, which means that if you don't know how it all interacts together, you could mess someone up by giving them wayward advice or incomplete advice. And I feel like that's where a lot of non-medical professionals giving this type of advice fall into, is it's incomplete. We have an idea, but not the whole picture. So I steer clear.
I feel like a lot of people too want to use it as a shortcut. It's
Yes.
like I have people who come in asking for some of those things, and I'm like, well, have you done all of the like other things you need to be doing to increase your milk supply, like power pumping or doing lots of skin to skin? Well, they're like, no, I just want to increase my supply. Well, you have to do you have to be sending your body all of the other signals before like adding something like that has potentially a ton of side effects is a good idea.
Mm-hmm.
Yeah, exactly.
Yeah. We are focused. We need to focus a lot more on the base, like the essential part. The only thing that is necessary to create milk is milk removal. So if that's not happening, then these other things are they're just going to add more things that you're doing, add more things to your day, possibly add more like side effects, and disappointment a lot of times if you're not doing the most important steps of creating milk.
The way that I think about it, and correct me if this is not an appropriate analogy, but I kind of see it as like if somebody is trying to get pregnant and they jump straight to getting medical help. right? And they haven't been doing the things to try to get pregnant in the first place. They haven't been, dad is wearing really tight underwear and getting into hot tubs and smoking, and, they're still drinking alcohol, and like they're not doing the steps toward increasing their fertility at home. And then they go straight toward, and then just like not having frequent sex, or they're not even tracking. And then they want to go and get put on different medications or try IUI or IAVF. And, when you would go to a medical professional for that, they're going to say, we need you to do all of these other protocols at home for 6 months, because even if you get this medical help, if you're not doing those things, it's not going to be effective.
Mm-hmm. Yeah, absolutely.
That's kind of how I see it.
Yeah. I like for, like whenever we get into the food galactagogues, I'm like, sure, if you want to do that, like eat
Right.
the food that supports your blood volume as like
Totally.
a fun added thing. It's like sometimes it's just like fun to be doing getting a treat that maybe is also supportive of breastfeeding, but not that's not what's going to make you make milk.
Yeah, like whole grains, dark green vegetables, nuts and seeds. I mean, yeah, please
all
eat those
you
things,
want all day long.
Sounds great. Unless you have an allergy, then don't do that.
And I felt like, though a lot of those like breastfeeding treats are very high in sugar, so maybe not all day long, but
make your own.
I mainly like those for a like when you're pumping, and like one of those like tricks to kind of just like relax and feel good to help the milk flow. Having a treat that has some really good high quality ingredients in it could be beneficial, just to kind of just help you relax, help you feel good.
Yeah, I mean, I'm highly food motivated. If I go pump, I get my cookie. That might work.
These are my cookies that I'm only allowed to eat when I'm pumping.
And I only get cookies when I'm pumping.
And it's like, now I'm pumping 12 times a day.
Man, where's this weight gain coming from? It's got to be the hormones.
You're just retaining water.
Oh, clearly. All right, let's be real. I'm doing this. Gosh darn it, I do not have time. It's going to be great.
Oh, goodness. Let's see. Yeah, whenever it's talking about the foods and stuff, it's like all of this is just some of the things that are known to help are like B vitamins. Like any part of your diet that's going to help support your milk or your blood, like supportive of blood volume, because your milk is produced from blood. That's how essentially how a lot of these are working. It's like you're nourishing yourself and supporting your body, and your body is best able to make milk whenever you're healthy and have a so but then that is also, none of it works if you aren't removing milk.
Yep.
All right. Chapter 13 is supplementation. And yeah, I mentioned this earlier, actually, like how it like goes into a lot of detail on how to supplement and like different methods of supplementation. I was very happy with the first, like early on in notes, the WHO recommendation that for supplementation, first choice is breastfeeding, of course. Second choice would be mother's own milk. So supplementing with your own milk that could have been expressed prior to baby arriving, or, you know, other hours a day whenever you're separated from baby. And then the third choice would be another mother's milk. And we go into, and we can discuss that more in a minute. And fourth choice the very last choice is infant formula. But there is a lot of controversy around milk sharing. So let's talk a little bit about that. Have you had clients that do get milk donated from like the just like public milk sharing or from milk banks?
Heck yeah.
Yeah, a lot of times.
Have you actually, like, because it goes into a lot of safety practices, do you find that parents do any of these things? Because like I've participated in milk sharing from like the donor perspective, and I've never actually had anyone like ask me about like my medical history or anything like that. So I kind of wonder how many people do some of these safety practices and risk assessments.
So Bloom Pediatrics, you can go to the milk bank, get that. If clients do that, obviously Dr. Lauren's doing that for them, so then they don't have to do that. You know, there's places like you give birth at a hospital that already has a milk bank there. You know, got clients that do that. I just had a client do that 2 weeks ago, where she wasn't very happy with what she was producing at the time, and so she did some donor milk from there, and then obviously they're the ones that are taking care of that. As far as like, you know, I'm getting milk from my friend or my sister, which is one that I have, you know, quite a bit of experience with. My sisters and I breastfed each other's children. I'm not lactating anymore, but my sister just had a baby and just a few days ago, and my other sister is still lactating, and they were breastfeeding each other's babies here. Don't need to take the medical history because we know them, you know. But no, I have not had someone on their own go through that, but I can imagine that there are people that do. I guess the people that don't. Some people are just very concerned and kind of willing to get what milk that they can because they can't afford to purchase it. And I think some people just don't know that that's something that they should be doing.
I always tell people to be really careful if they're buying it, because like from a non-regulated source, because then there's motivation to water it down or add other kinds of milk to it or whatever. So most of our clients are getting it from somebody they know, or we've even had a few of our nurses who had oversupply who were donated to some of our clients. So
that's awesome. I like that.
Yeah, it's not recommended to purchase milk from like an unregulated source, from like individuals, or from like there's a few places that like will buy milk from individuals and then resell it, and there's too much risk involved in that. It is pretty common practice for them to for people receiving donor milk to like reimburse costs of milk storage bags, or like get purchase the bags and give them to that sort of thing, but like just paying per an ounce, unless it's like from an actual milk bank, is not recommended. It does give the steps in here for like flash heating to help prevent any transfer of disease or if there was poor milk storage practices going on. And yeah.
I didn't know about any of this when I was I needed help. I didn't make enough on my own. And I had 2 friends who were oversuppliers. It's extremely convenient. They were pumping just to get it out, and they'd come over and they would just hand it to me, and I'd be like, oh, thanks. And I just put it in a bottle and give it to my baby. And it never even occurred to me that it might not be hygienic.
Well, I feel like getting it from people that you know and trust would be a good risk averse way of doing it.
That's true.
Though there are a lot of other ways that people get connected with milk donors, like Happy Feet, or I'm trying to think of the name now. There's like networks that you can get involved in. And you may not necessarily know the person. And so if you like some ways that you can't, it is acceptable to ask for like their screen, like HIV screenings that may have been done during pregnancy. I mean, that type of information would be important to know before using someone's milk. So if anybody's not willing to give you that information, then that would be like a red flag.
Yeah. Agreed.
All right. And then we get into like how to know how much supplement you need and all that, which is more stuff that goes outside of the scope of what a doula should be helping a client with. Though, if you do notice like signs of poor nutrition in a baby, you can always point that out. It's like maybe you need to take them to see their pediatrician, type of thing. Like it's normal for babies to be very tired as newborns, but if they are difficult to arouse, then that would be a red flag. And yeah, so usually if there's concern with weight gain, as long as they're being taken there, pediatricians are going to flag concerns about poor weight gain. You're more likely to have a problem with them being over concerned about poor weight gain than like missing it. So that, one thing in here that I learned was about infant massage helping babies to gain more milk or more weight on less milk. And that was
like, how does that work? 47% more weight on the same amount of formula. That's a huge increase. Now it is specific to formula, but
I mean, the study was formula, but I doubt that it's just like applicable to formula.
Right.
I'm my guess is that it's just along the lines of like how a baby who cries less is going to use less calories so they can gain more weight. A baby that's relaxed won't, and maybe doesn't have as much digestive difficulties, because infant massage can really help digestion and gassiness and stuff, just make them use less calories and to function. So then they're using that nutrition to actually grow, would be my guess of how infant massage would work in helping babies to gain weight. But
yeah,
super interesting.
Keep that baby nice and lazy.
You know, it was not something that I had ever like considered as far as like how to reduce the amount of supplementation you need, is to work on having a more relaxed baby.
Right. And I could see that being difficult with an adopted baby that's coming from a difficult situation. Because they tend to just be like they talks about in the beginning of the book. There's all kinds of tips and tricks to try and help them relax, because they might be on edge just from where they came from and their past experiences. So I could see that child then needing even more food based on that new information. It's like, oh, I can see that, you know?
Yeah, it makes a ton of sense.
Especially if they were being overfed previously to get them to be quiet.
Yeah. And I just like, I just love how much this book humanizes babies.
Me too. You mean they're people?
Yeah. They're born that way, actually.
Tiny people.
Actually, they're in the womb. They have their own personalities. So
Little squishies.
and